So our next lead talk is on requisites of an ideal resource center of ophthalmology by Dr. Professor Dr. Sopan Samanta sir.
चलिए अंत भला तो सब भला
Chalo. Hey, slide. Respected chairperson and the honorable delegates present here. My presentation will be very brief because already you have discussed everything. After working in medical college with undergraduate and postgraduate for the last 44 years, I have retired on 1st of January 2024 at the age of 70. So I just like to narrate some of my own ideas and what should be the requisites of an ideal resource center of ophthalmology. From centuries back, during the days of Nalanda, during the days of Khajuraho, all these universities, you see, the golden treasure of any teaching institution are the resource centers. They have got their own libraries and everything. That's why I think for proper teaching and training program, there must be a good resource center. So what are the requisites of resource center and why it is required? To collect as well as organize materials, those are useful to a particular group of people. This group of people are nothing but our students, these resource centers. This will provide information to upgrade their education, provide regular assessment assistance, and provide educational service and guidance. Now, what are the resource centers? Number one is library. This library is most important. This second is the archives, that is the museum or archives. Third is skill transfer labs, what we have already discussed. Fourth is simulation, same thing. And fifth is hand-on course. This library, we all know, is all packed up with printed books, with charts. Now newer edition is e-library along with the copy facilities. Whenever you are in Calcutta, you know Calcutta harbors the ancient library of Indian subcontinent. If you be to the School of Tropical Medicine, Calcutta, you will be surprised to know they have got the books more than 2000 years old with all in these palm leaves and others and written with ink. And in that library, they only allow the researchers to go there with wooden steps. You can go upstairs and you can get all these beautiful books, and where you can find out that Cantharis fly well was used for the treatment of iritis in 10th century or in 7th century with all those. And you can see all those printed in wooden blocks of all beautiful literatures. You can find out that atropine can be used in leprosy patients for as long as 35 to 40 years. All these are there in that School of Tropical Medicine library. So this library is the golden treasure with printed books in different printed forum. Second, charts. You know, for centuries together we can get so many charts, right from the days of Leonardo da Vinci and also back. The charts were found out even on carving as well as so many ancient places in different forum. And latest edition is e-library. E-library is a beautiful thing. The students can access it at any time, but everything requires copywriting, whether a Xerox copy or copying in different forum. Now archives, that is another golden forum. Here in Calcutta, if you have got the time, you can go to the National Library. In National Library, they have, that is the golden treasure of so many beautiful books, models, charts, and model of old instruments even. And in Calcutta Medical College and in different medical college, you can get beautiful archives of model of old instruments. The very first slit lamp, which was invented in the year 1852, that was there in Calcutta Medical College like this, and the xenon arc photocoagulator. these sort of old model instruments are also there in so many institutions, and the evolution of modern ophthalmology, that is not only interesting, that will give you some numerous thoughts to think over for your research work and others. And the most important is the old thesis. I do not know about other universities, but in Calcutta University, you can get old thesis for the last 70, 80 years old. So whenever we ask any student to prepare his dissertation, they can jolly well go to the library and find out so many old theses and can prepare some sort of dissertation by going through 25 years or 50 years back. And lastly, the skill transfer course. You all know the skill transfer course we have already discussed. There is a demonstration of the technique. There is self-performance and recording. But the most important, viewing of the performance in leisure hours. What we practiced whenever we were student, the trainees in Arvind Eye Hospital about a quarter of century back. Whatever we used to operate, they used to give us this particular record, and in the evening we have to go through these records in our leisure hours in the library and have to gone through by slow movement and what wrong we have done, so that in the next day we can check and we can refresh ourselves, the critical review, and afterwards the publication. And hand-on course, this has already been discussed by the previous speakers, on model eyes, on dead animal's eye, goat's eye, on cadaver eye if possible, on human eye under supervision. And now it is all a debatable chapter. But when we have practiced trabeculectomy operation or other such sort in painful blind eyes when we were students at Calcutta Medical College in 1980s, about 50 years back. But I don't know whether it is practical or not to practice on painful blind eyes. Not. With these few words, I like to initiate this discussion. Thank you very much.